It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to this week's episode of Morton in the Morning. I'm your host, Julie, and we are coming to you right here from Morton Hospital, your community hospital in Taunton. Our show airs every Wednesday at 11 a.m. right here on WVBF, your hometown radio station. Believe it or not, just recently we actually hit the 2-year mark of our show. Time sure flies, that's for sure. It does not feel like we've been doing our show for 2 years, but that's the truth. And we hope that we have been able to generate some new and continuous listeners over the past couple of years. We hope everyone has been enjoying our shows. We do have a great new show for you today, and a couple of great shows that we recently aired over the last couple of weeks on the topics of mental health. So a couple weeks ago we had Brienne, who is an LICSW in our psychiatry clinic. She shared some great information about mental health and wellness, some great tips on stress management, and what to do if you or someone else seems to be struggling with their mental health. And then last week we had Dr. Morar and Dave from our psych clinic, and they spoke about an ECT program, which is electroconvulsive therapy that we offer here at Morton Hospital for patients with severe depression and some other symptoms and diagnoses. And Dr. Morar spoke about her role in our outpatient psychiatry clinic, as well as her role in our emergency department. We have a psychiatric consultation team that supports patient care in our emergency department. And she spoke a little bit about how that team is having such a positive impact on the patients they are coming in with behavioral health concerns. So today's show is actually going to be about gastrointestinal or GI issues. We have a great mid-level provider from our office over in the Thayer building here at Morton Hospital, and she's going to talk about some of the common GI related conditions and diseases that they treat in the office, and also about some screening recommendations that you might not be aware of. Some of those have been updated recently over the past couple of years. But before we get into the interview today, I just wanted to share some updates. So first, a reminder about how you can contact us here at Morton in the Morning. We have an email address, which is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. We would love to hear from our listeners. Again, we just hit our 2-year mark of our show. We want to hear how you're enjoying it. If you have any follow-up questions you'd like to ask about past shows, or if you just want to suggest a topic, is there something you'd like to hear about, or maybe a doctor or a department that you'd like to hear about? We would love to hear your suggestions. So reach out at any time at mortoninthemorning@steward.org, and we'll be happy to get back to you. We also want to let you know that if you have missed any of our shows, if you're a new listener or you were away on vacation this summer and you missed a show but you heard about a great topic, you can always listen to our shows online. So WVBF does a great job of uploading those for us to a YouTube page, and we share the link to our shows on the Morton Hospital Facebook page. So if you go to facebook.com/Morton Hospital MA, or just search for us on Facebook, you can find our page, like and follow our page, and that's where you can stay up to date on everything happening at Morton Hospital, and also find the links to our shows every week that we will post so you can listen online. We also want to let our community know that thanks to your nominations, Morton Hospital is in the running. We are in the top 5 for the 2022 Best of the Best Community Choice Awards. That is a contest that we participate in every year. Thankfully, we actually won in several categories last year for 2021, including receiving the Best Hospital designation for the Metro South region. This year, we have made it to the top 5 in 6 different categories, which is our all-time high. So thank you to everyone who nominated us. We are in the running for the categories of hospital/medical center, audiology specialist, orthopedics center, places to work, physical therapy clinic, and weight loss clinic. So we are so excited. It's a great testament to our team here at Morton Hospital for all the great work that we do, that we are even nominated in these categories and in such great competition with so many other wonderful health clinics and outpatient centers in the Metro South area. So we are flattered. We thank you for your nominations. And now we are asking for your vote. So we are now in the voting phase of that contest. The voting goes until August 23rd, and anyone can go on and vote. You can actually vote every single day. You can vote for us once a day in all of those categories, as well as your favorite businesses in many other categories like restaurants, etc. So you can find the link to vote for the contest on the Taunton Gazette page, on the Brockton Enterprise website, or you can go to the Morton Hospital Facebook page, facebook.com/Morton Hospital MA. We will be posting about the contest there, and you can click on the link and again vote for us in those 6 categories for the 2022 Best of the Best Community Choice Awards. So we've got a lot of great content to cover today, again talking about gastrointestinal diseases. So let's get right into today's show. So today we're so happy to be speaking with Amber Lippa. She is a physician assistant with our gastroenterology office, which is located over in the Thayer building at Morton Hospital. It's the Stewart Digestive Disease Center of Taunton. So welcome, Amber. Thanks for being on our show.
Thanks for having me.
Tell us about yourself and your background.
So I'm originally from this general area. I grew up in, the southeastern Massachusetts region.
Okay.
I did go from high school. I went to school in Connecticut, and I spent about 7 years there between undergraduate and graduate school.
Mm-hmm.
And then I moved back to the area afterwards. But essentially, I knew I wanted to be a PA right around the time I was finishing high school. So I applied to a couple of, they're called direct entry level PA programs, where you combine undergraduate and then are already sort of accepted to the graduate portion when you're done with the 4 years of undergrad.
Okay.
So I ended up getting accepted to a program like that at Quinnipiac University.
Nice.
In Hamden, Connecticut. So I spent, like I said, almost 7 years doing that. And then afterwards I was toying with the idea of staying, but I eventually decided to move back to, generally speaking, where I was from.
Okay.
And my first job was in the emergency department.
Oh, wow. Where?
Yeah, so in New Bedford.
Okay.
St. Luke's.
Yeah.
I really liked that. I spent a little over 8 years, I believe, doing that. And then I decided I wanted to make a change. So a little over a year ago from now, I decided to come here and join Stewart.
Well, we are certainly very glad that you decided to come here and join our team because, look, now we have this thriving practice with you and Dr. Pappas and the MAs and the rest of the team. So we are very fortunate to have you, and also thank you for being our guest today. Unfortunately, even though we have a lot more to go with Amber, it is time to take our first break of today's show. So if you're just tuning in, we are here with Amber Lippa. She is a physician assistant. She works out of our Stewart Digestive Disease Center of Taunton office, and they specialize in gastroenterology, so gastrointestinal diseases. And when we come back, we're going to talk about some of those diseases. What are the most common ones that Amber and Dr. Papa see in the office here in the Thayer building? And also go over some updated screening recommendations for things like colonoscopies as well as hepatitis C. So to our listeners, thanks for joining us today. We're going to take our first break, but we will be back with more talking about GI diseases here on our show with Amber Lippa of our SMG office over in the Thayer building. Stay tuned. We'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to Morton in the Morning. If you are just tuning in, our show today is all about GI diseases or gastrointestinal issues. So we have a great guest. Her name is Amber Lippa. She is a physician assistant right here in our Steward Digestive Disease Center of Taunton office over in the Thayer building at Morton Hospital on the second floor. That is a newer office. They've been here for, I would say, about a year, maybe a little bit over, and they are thriving. They are very, very busy because a lot of patients obviously have some of those common GI issues that they are struggling with. So Amber's our guest today. We have a lot to talk about. Before we took the break, we were talking to Amber a little bit about her background, how she got into the field of gastroenterology, and she just recently joined our team from the South Coast area, and she was actually working in an emergency department before coming here. Now, you were in the emergency department, but were you doing like GI stuff, or what were you doing in the emergency department?
A little bit of everything there.
Okay.
So, not in-depth GI, but you do see GI stuff and, take care of some of the sicker end of the GI patients that need admission to the hospital and that type of stuff.
Okay.
So I always knew I liked it, but I decided that out of school I wanted to do something a little more broad.
Okay.
Because with PA school, you learn a little about everything kind of, and then you sort of learn more on the job after school. So I didn't want to specialize too early.
Gotcha.
I wanted to do, like I said, something more general.
Yeah.
And you learn a lot of procedures and things like that in the ER.
Great.
And you learn essentially, how to tell if someone's really sick and take care of them.
Okay. And what was it about gastroenterology that really interested you?
So part of what I really like about it, and I always liked even in school, was the broadness of it. Basically, you take care of the whole GI tract.
Yep.
So you're taking care of things like esophageal issues, stomach issues, anything throughout the smaller, large intestine, the liver, some parts of the gallbladder. So there's a lot of variety to it, which I like. And it's not super specialized. It's kind of still broad within its own specialty.
Okay. Yeah, I think there's probably a lot of areas of GI or gastroenterology that the general public probably doesn't even know about. So we'll definitely get into some of that stuff as well. I always just think of, the common things like, upset stomachs, acid reflux, things like that.
Yeah.
It sounds like there's so much more to it. So
there is a lot, yes.
So we'll definitely get into some of those areas today. So your experience here is your first, position in your career, like in an office setting.
Yes.
Awesome.
Correct.
And given our office is somewhat new, can you talk a little bit about the team there?
Yeah, so when I joined last summer, it was, at the time, Dr. Pappas, obviously, who's the doctor in the office, and the office manager, Rebecca. And then we had one secretary and had just had another secretary join us at the time. And then, again, was one medical assistant. Now we've grown to have two medical assistants. So total right now we have myself, Dr. Pappas, office manager, two secretaries up front, and then two medical assistants.
Okay.
And then we have Anne Marie, who kind of oversees the whole thing a little bit.
She does. Yeah, she's a great member of the SMG team.
Yes.
So, I guess we should have referenced the group is a Steward Medical Group office, which we have many of, both primary care and specialty care offices. And I think we're also trying to get another MD on board at some point, right? Because you guys are really, really busy.
Yeah, so it sounds like the plan is to grow, the practice, and hopefully that'll keep growing. In just a year, it seems like we've already grown quite a bit.
Absolutely.
So hopefully it'll just keep on going.
Yeah, and it's great to have you guys right on site here at the hospital too, you know, for
very
any follow-up
convenient.
needs and whatnot.
Yes.
And, you know, conveniently located to our day surgery center because some things require a visit there, so we'll get into those topics as well. So I wanted to sort of talk about in general, because we mentioned there's so much to GI, but what would you say are maybe like the top 3 to 4 common issues that you see in the office, and maybe you can explain a little bit what each are.
Yeah, so, I mean, I don't know the full statistics, but I would say off the top of my head, a lot of common complaints have to do with GERD, you know, acid reflux.
Is that the same thing, GERD and acid reflux?
Essentially, yes.
Okay.
Yeah,
What does GERD actually stand for?
So it's like gastroesophageal reflux disease.
Oh, okay.
Yeah, so it kind of just the layman's term, I guess, would be acid reflux or heartburn.
Gotcha.
And so we see a lot of patients that suffer from that. We see a lot of patients with various complaints kind of involving their bowels, you know, whether it be constipation or diarrhea or both. We see some patients with concern that they've developed just like in general a change like in their bowels overnight, sort of almost. Blood in the stool, changes in the nature, you know, appearance of their stools, things like that. I would say that umbrella of things is probably the most common.
Okay. Now, a lot of these issues, do they have a lot to do with like the foods we eat, or are there sometimes underlying conditions that cause these?
Yeah, it could, or it's a mixture of both potentially. You know, someone who suffers from true celiac disease, which is a gluten intolerance allergy.
Yep.
That definitely is, you know, their symptoms would be related to what they're eating if they don't know to be avoiding gluten. But some people, you know, different triggers, everyone's a little bit different what triggers them.
Yep.
The common ones for something like reflux would, you know, typically like spicy foods, tomato sauce foods, things like that.
Okay.
But again, everybody's a little different with that.
Yeah. I notice when I eat pasta anytime I have red sauce, even though I love it so much, I love Italian, but I do get a little bit of heartburn.
Yep.
And I'm like, you know, it's definitely the sauce.
It sits with you.
It does. Now, you mentioned celiacs. Is that something that's becoming more common? Because you hear all the time about people that are trying to avoid gluten or gluten allergies. Like, can you actually test for that and find out someone has the gluten allergy?
You can test for it. Yeah, there's a there's a way to test for it through the blood, and then the confirmatory way, if indicated, would be you could tell based off biopsies from their part of their small intestine that you could take a biopsy of, and it would show signs of celiac disease.
Okay.
Some people they find that they're triggered, I guess, by gluten, but it's not necessarily a full celiac disease, so there's definitely ranges of it.
Okay.
But I don't know if it's getting more common or if we're just testing for it more.
Right.
It's hard to
Recognizing it more, and
Yeah,
it's now
we have more
something people know
resources.
about. People know what gluten is now, whereas maybe 10 years ago, people were like, what is
that? Which is good in the way, you know, it's definitely good, I guess, to find, you know, more people are getting diagnosed with it, so they're not going their whole life without realizing they have it.
Right.
And I think there's also a lot more, I guess, products available to them, and restaurants seem more tolerant and, you know, have more options. So
Definitely. You always see little GF on menus, or there's so many different variations. The V for vegan. There's many, many more, because it sounds like a lot of people these days have, you know, special diets that they have to follow in order to avoid these types of things. Now, with celiac, is that something that people are sort of born with, or what causes it?
So I don't know how much we necessarily know about that per se. It's considered, I guess, under the umbrella of like an autoimmune condition where you might not know about it till later in life. Some people, you know, we have patients who find out they have it in their 70s and 80s. And it's like they never, you know, their whole life they had no idea.
Wow.
Some people have no symptoms really. Sometimes they'll have symptoms like very non-specific, like anemia or something like that, and it ends up being that. So yeah, it's pretty wide.
Yeah, it sounds like you guys have to do a lot of investigating to pinpoint what exactly is causing all these issues.
A lot of investigating.
So I know that your office works closely with the day surgery center. A lot of your patients have to go get colonoscopies
Yep.
for various reasons, I'm
And
sure.
upper endoscopies.
Yes, okay. So let's talk a little bit about colonoscopies. Are they still recommended for prevention?
Yes, definitely. They're actually even more recommended than they used to be.
Oh, okay.
So the age people probably think of a lot of times is 50 to start screening for colorectal cancer, but actually about a year ago, maybe a little bit more, the U.S. Preventative Services Task Force, they decided to bump up the age to 45.
Oh, okay.
So and this is important to differentiate, this is all like for average risk adults, meaning they don't have strong family history of colon cancer or like a personal history of colon cancer. You know, there's a lot of different factors, but for an asymptomatic average risk person, they moved up the age from 50 to 45. So the general statement is that adults aged 45 to 75 be screened for colorectal cancer in some regard. From 76 to like 85 or older, it's more of a a case by case basis, depending on someone's general health otherwise.
Okay.
And typically when we say screening, we mean colonoscopy. There are some more non-invasive things that you could use to screen, but at least in our office, we focus more on the colonoscopy route of it.
Is that still sort of considered like the gold standard for
Yeah, so it's
early detection?
Early detection, and also it's the only one that can detect but also remove a polyp, which is a big difference too. So
so you can remove something while you're there.
Yep.
Okay.
So I don't do the colonoscopies, Dr. Pappas does, but yeah, so while she's there, she can remove, with almost all polyps. Obviously there's always extenuating circumstances, but for the most part, a polyp that's detected is able to be removed at the same time.
Well, that sounds like a good option. Just,
Yes.
get it done
Get
while
it
you're
out.
there. Yeah,
Yes.
get it out. So you mentioned, people who are at higher risk. The normal age is starting at 45, but, what makes someone higher risk, and when would they have to start screening?
So that's the when is very subjective to like person to person. So I don't want to necessarily say that because there's just so many factors that could change. They'd have to talk with their own provider about that. But certain examples of higher risk people would be, a strong family history, meaning like a sibling or a parent. In other situations, sometimes others, but those are the main ones where they had detection or they were diagnosed, with colon cancer or precancerous polyps at an earlier age, so they may qualify for earlier screening. Again, the exact when is very dependent on the person. Someone who has inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, they could be considered at a higher risk. So, but normally those people are definitely plugged in with someone that they would be discussing this with. So, usually they already are aware. And then there's a couple different genetic syndromes that if you have in your family, you would definitely qualify sooner as well. But for, the general person, 45 is the magic number now.
Well, that's really helpful because, as always, we want to keep our community updated on screening recommendations, especially if they have changed, because some various annual screening recommendations, or others that are less frequent have changed over the years based on the newest guidelines from various organizations. So thank you for going over that with us so that our listeners are in the know about the most up-to-date recommendations. And I do also want to talk about an area that, I never thought to associate it with, GI offices, but hepatitis C. So that's something that we want to talk about when we come back, because that is a condition that you do treat, that GI specialists do treat, and there are some also screening recommendations for hepatitis C, which our listeners might not be aware of. So before we get into that topic, unfortunately, it is time for another break because we are just about halfway through our show. Before we do, a reminder how you can contact us. Send us an email anytime at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. We'd love to hear from our listeners. If you missed something earlier in the show and had a follow-up question, feel free to reach out to us, or if you wanted to share any feedback about our interview today with Amber. So we are going to take a quick break, and we'll be right back with more with Amber Lippa of our Steward Digestive Disease Center of Taunton office. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the second half of today's Morton in the Morning show. Thanks so much for tuning in. We have a great show for you today. We've already covered a lot of great information with our guest, and her name is Amber Lippa. She is a physician assistant, and she works out of our Steward Digestive Disease Center of Taunton office. That is a gastroenterology office. She works very closely with Dr. Alexis Pappas. They've been here in our office for about a year, maybe a little over a year now, and there is definitely a great need for them here. They are very busy, but they are always open to accepting new patients if you have any GI issues. So earlier in the show, we talked a little bit about what some of those most common GI concerns are. And then we started talking a little bit about screening recommendations. So before the break, we were talking about the updated screening recommendations for colonoscopies. One of the things we didn't touch on is frequency. Like, is this like an every year type of thing, every 5 years?
Again, it's very dependent. There's a lot of factors that go into that.
Yep.
Most people don't know the frequency that they'll need them until they actually have their first one.
I see.
So depending on if you have polyps, what kind of polyps they come back as on the pathology report, that all plays into, how frequently. Some people, it's not common.
Yep.
I guess could need it every year, but that's unlikely.
Okay. So the best thing to do is really consult with your doctor. And now, if you're around the age of 45, will your primary care provider tell you you need to start having this done? How does that all work?
So as far as I'm aware, that's usually how it works, when you get your regular physical exam.
Yep.
Again, assuming these people are not complaining of symptoms or have any extenuating factors, it's like kind of going down the list of, have you had your annual pap smear? Have you had a mammogram? It's kind of lumped into those preventative measures. And if you qualify and you're interested, the primary care doctors will put a referral into us. And for the most part, a regular screening colonoscopy, if the primary care orders it, we don't necessarily have to see the patient in the office first.
Oh, okay.
We just book the procedure.
Yeah, and she probably does many of them because there's such a common and recommended screening. So what does someone have to do if someone has not ever had a colonoscopy, but they're getting toward that age? What's involved in the preparation? I hear a lot of times, people will come into the front desk saying they had to drink the drink.
Yeah, the drink. So every office / probably provider does the prep a little bit differently. I read a copy of our sheet. So our default method is basically a combination of Miralax and Gatorade, usually.
Interesting.
So you mix that mixture. It's about 64 ounces of fluid you have to drink total.
Yeah.
The day before the procedure.
Those not too bad.
It's not too bad. You split it in half, so you drink 32 ounces around 4 p.m. and then the second half, the other 32 ounces around 8 p.m. And this is in conjunction with some Dulcolax, which is an over-the-counter stimulant laxative that kind of helps also. In addition to that, the whole day before, you're on a clear liquid diet.
That's probably the toughest part.
Probably. So normally that consists of, you could have Jell-O, you can have popsicles, Italian ice, chicken broth, things like that. Just nothing red or purple, because it can kind of look like blood, which is confusing. So
very interesting.
Try to stay away from that. That's like the general one. Sometimes people need to do a 2-day prep.
Okay.
But again, that's very individualized. So I would say the common route is just the normal 1 day before doing all of that.
And a colonoscopy is an outpatient procedure, right? I mean, how long does it take? And then what about recovery? Is there any sort of recovery involved, or people feel fine afterward?
So a typical screening colonoscopy is definitely an outpatient procedure. Most of the time it's something that's very routine. The actual procedure takes usually less than 30 minutes. But the whole process takes a few hours, out of your day, door to door.
Sure.
You need a ride home because you do get medicine to put you to sleep so that you're not really aware of the procedure and you don't feel any pain or discomfort. But it's a moderate sedation. It's not like a full anesthesia like you would get if you were getting your appendix out or whatnot. So it's a little bit lighter than that.
Okay.
Yeah, so for the most part, you have to do the prep, so the day before is a little bit interrupted by that. The day of is interrupted for a few hours.
Sure.
And we usually recommend people don't go to work or drive for that whole day. But by the day after the colonoscopy, for the majority of people, they're back up and running like normal.
Okay.
Obviously, there's exceptions always, but, the most part, that's how it works.
All right. And the colonoscopy screening, I mean, I'm sure that is used to detect any types of colorectal cancers, the polyps like you mentioned. Is there anything else they're used for?
So the polyps are definitely the most important because, it's easier to conceptualize this way. So all colon cancers start off as a polyp at some point. So if you remove that polyp, it removes the chance of that polyp becoming cancer.
Okay.
So not all polyps will be cancer, but
right.
That's kind of how it starts. So it's important to stay on top of getting those removed so that you prevent any, further issues.
Great.
So that's the most important part.
Okay.
If it also could detect a more advanced, like full-grown colon cancer, which usually we like to get ahead of it, and that doesn't, become the case. But
yeah.
And then also, it depends. So a screening colonoscopy is essentially looking just for polyps and in the rare event cancer. But if you're having symptoms and we're doing the colonoscopy for more of a diagnostic reason, then it's oftentimes we're looking for things like signs of Crohn's disease or ulcerative colitis.
Okay.
Or something called microscopic colitis, things like that.
Okay.
So it really depends, screening or diagnostic, meaning you're having symptoms and we're trying to get to the bottom of it. So.
Okay, all right. So when we were talking about doing this show, I know one of the diseases that you had mentioned, that we should touch upon was hepatitis C. And that was surprising to me because I never think of, that being associated with GI specialists. So tell us, what exactly is hepatitis C and what organs does it affect? How is GI involved?
So that kind of goes back to when I said I liked GI because it's so diverse.
Yeah.
And I agree, it is something a lot of people don't realize the liver is involved, but we do see a lot of liver patients, meaning like hepatitis C or cirrhosis, things like that. So in general, hepatitis C it's actually the most common chronic bloodborne infection in this country.
Okay.
It is something that often is asymptomatic, especially, at first, and it essentially only affects the liver for the most part. And the reason why it's important to kind of screen for it regularly, similar to doing all these other regular things like colonoscopies and mammograms and all that fun stuff, is because most people don't realize they have it until they get screened for it. So, and the danger of having it for many, many years and not realizing you have it is it can affect your liver to the point where you could even develop like a cirrhosis of the liver, even if you've never drank alcohol in your whole life. A lot of people associate cirrhosis in general with just alcohol, but it can be caused by other diseases of the liver as well.
Okay.
And hepatitis C being one of them.
Okay.
So right now the recommendation is to screen anyone over the age of 18
Oh, wow.
at some point
Yeah.
for hepatitis C, just in case.
Okay.
That they have it and would want to take care of it before it progressed to being many, many, many years down the
And
road.
what does the screening entail? Like, could someone have been screened and not even know it, or will they know?
Probably. I mean, if you look into your records and things, I'm sure you would find it, but it's a simple blood test.
Oh,
So
okay.
some primary care doctors do them as part of their normal panels,
Gotcha.
especially for people with ongoing risk factors for it, meaning like people who inject drugs, maybe they share needles, syringes, other things like that. Those populations typically are screened more frequently. And also, it's part of the normal screening process during pregnancy as well.
Okay.
So for prenatal care, every pregnancy, at some point, don't quote me on which week, but they get screened for it to prevent, possible transmission
Sure.
to the baby. So,
Okay.
so yeah,
So
just the blood test.
Is hepatitis C something that's treatable? And if so, how is it treated?
Yes, so it is treatable, which is great. It's very helpful that we have medications now that are more, I guess, targeted and easier to cure. I wasn't practicing then, but back in the day, quote unquote, they would get treated with essentially an interferon infusion, which was a much more rigorous process and had a lot more side effects, and it was more cumbersome to go into, an office and get this transfusion and whatnot. So now we have different oral medications that you can take. It's once, depending on which one, it's usually a course of either 8 to 12 weeks.
Okay.
And it's usually once or twice a day where you just have to take a pill.
Yeah.
Usually they're pretty well tolerated, not many side effects. Usually if there are side effects, they're pretty minor and they usually go away once you acclimate to the medicine. And at the absolute worst case, they go away once you stop the course of it.
Okay.
So that is very helpful, and we've definitely had a lot of patients get cured from their hepatitis C
That's great.
from these medications, which is great. The only, I guess, important thing to know about if you were to be treated for hepatitis C, you always have the ability to get it again if you were to be exposed again. So
I
it doesn't
see.
make you immune to it,
Gotcha.
but it does get rid of that one you had. And most people, that's that.
Okay.
They're done. So
All right. Well,
So,
very
yeah.
interesting. Definitely good for our community to be aware of. And like you said, anyone over 18 to be aware of that it is recommended for them in general. So thank you so much, Amber, for going over those screening recommendations with us. There's so many different screenings to keep up with, but as you said, hopefully your primary care provider should really be staying up to date on those and prompting you when you are due for those screenings. But obviously, if you have any questions, it's always great to ask your primary care provider, what screenings am I due for? Did I miss any? Is there anything that you recommend that I have at this time based on your age, etc.? So keep that conversation going with your primary care provider so that you can stay up to date on all of the recommended screenings to maintain your optimal health. So we are going to take our final break of today's show, but when we come back, we do have a couple wrap-up questions with Amber just to sort of summarize everything we talked about today and, just ask her to let us know anything else she'd like our community to be aware of about the services that they offer over in their office. So stay tuned. We are taking our final break of today's show, and when we come back, we will be back with more with Amber as well as some general hospital updates. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to this week's episode of Morton in the Morning. Here's the final segment of today's show. It's been a great show because we have a wonderful guest, and her name is Amber Lippa. She is a physician assistant in our Stewart Digestive Disease Center of Taunton office, and they specialize in gastroenterology. And earlier she was talking about some of the most common GI conditions and concerns that she sees in the office, along with Dr. Alexis Pappas, who is our MD over in the office. And we've also been talking about various screening requirements for colonoscopies and hepatitis C, and just all the great work that the office is doing over there in the Thayer building at Morton Hospital. It sounds like your office definitely takes care of such a variety of issues and diseases. In general, if people are listening out there, what do you want the community to know about the services that you offer?
So, as we sort of touched upon, it is helpful for people to realize the wide gamut of conditions we see.
Right.
So, as we kind of went over, I would say anything with the esophagus, the stomach, the intestine, so like the small intestine, the colon, even the rectum sometimes, certain pancreas conditions, certain things with the gallbladder, not straightforward, cholecystitis, things like that would need a surgery, but certain things we do take care of sometimes, and then the liver, so like liver cirrhosis, whether it be from alcohol abuse, hepatitis C, or even non-alcoholic fatty liver can sometimes turn into cirrhosis of the liver. So there's all sorts of ways to get it, and once you have it, it definitely is important that they follow with a gastroenterology team to prevent it from progressing.
And when, if someone has, chronic, stomach pains, things like that, at what point should they really say, I should see a specialist for this? This isn't normal.
So usually, at least in our office, the process is they discuss it with their primary care provider, and at that point they decide. Sometimes they'll do some preliminary tests and they pick up on something and it gets treated, and that's that.
Yeah.
Other times they do a lot of preliminary tests, they don't find any cause, they still don't feel well, so they get referred to see us.
Yeah.
Or you could just, always ask their primary care doctor if they think you should see a gastroenterologist, and they would do what they deem appropriate.
Okay.
It is helpful to have somewhat of a kind of a triage process in that way, just so we make sure you're seeing the right type of specialist versus another specialty that you might not realize it overlaps with or whatnot.
Okay.
And it is nice too to have some testing done beforehand, before seeing us if possible, just so we have something to go on.
Okay.
But normally the primary care offices help a lot with,
First stop.
Yeah.
So is a referral always required, or can anybody for anything call the office and maybe you'd help them get the referral? More often than not, it's probably required, right?
I believe so.
Okay.
I'm not 100% sure, but if you call the office, we can always troubleshoot that in real time.
Awesome.
Yeah.
Okay, well, this has been really helpful, Amber. I think, hopefully we've brought some great recommendations on screening, to light, and different conditions that you're able to treat. So we are so happy to have you and Dr. Pappas and the whole team over there in the Thayer building to be able to care for the wide variety of GI issues, which you touched upon many of them today. So thank you so much. And after this, I'll share the phone number to your office.
Great. Thank you.
All right, well, what a great show. I personally learned a lot. I hope our listeners did as well. We want to thank Amber for her time today and sharing such great information. We touched on a lot of different topics and also provided those screening recommendations. And if you missed that, don't worry. Our show will be posted online. We've posted on our Facebook page, facebook.com/Morton Hospital MA. You can search us on Facebook. And we post all of our shows, a special link to listen online by the end of every week. So like us on Facebook, follow us so you don't miss any of our shows, and also so you can stay in the know about what's happening at Morton Hospital. So again, great content today. Thank you to Amber. Wanted to give you the information about the practice that she and Dr. Pappas and the team operate out of, not operate, but practice out of. And that practice is the Stewart Digestive Disease Center of Taunton. It is over in the Thayer building at Morton Hospital. It's up on the second floor, suite 2200. And their phone number is 508-828-7740. Again, that's 508-828-7740. Like Amber said, you can call the office if you have questions, but typically they do require a referral from a primary care provider. So if you're having some issues, talk to your primary care provider to see if the GI office is the best location for you to be referred to see a specialist. And if you're looking for any type of specialist or primary care provider, you can also find all of our doctors online on our website, mortonhospital.org. Click on our Doctor Finder tool, and you can search all of our providers there. You can search by name, you can search by location, specialty, many different combinations. So check it out online, mortonhospital.org, or again, follow us on Facebook to find out announcements about new doctors, upcoming events, and just see what's going on here at Morton Hospital, as well as listen to all of our Morton in the Morning shows. So we are almost out of time. Before we end today's show, just a couple of announcements. When we first kicked off today's show, I did mention that we are very excited about the 2022 Best of the Best Community Choice Awards. Those are now up and running. The voting period has started. There was the nomination period back in June, and thanks to everyone in our community, family, friends, neighbors, everyone who nominated us, we have made it to the top 5 in 6 different categories this year. Those categories are hospital/medical center, audiologist, orthopedics center, physical therapy clinic, places to work, and weight loss center. So thank you again to all who nominated us. The voting period has begun. It started yesterday and it will run through August 23rd. So you can vote once a day, every day in those categories. Please vote for Morton Hospital and help us recognize our team. You can find the voting link again on our Facebook page. So search for Morton Hospital on Facebook. We posted the voting link on our page yesterday. You can also find it on the Taunton Gazette or Brockton Enterprise websites. Just click on the contest page. You'll see it. They're probably advertising Best of the Best right on their home pages. And then you can get to the various categories where you can nominate Morton Hospital and those ones that I mentioned, as well as all of your other favorite businesses in a variety of other great categories. So please vote for us in the 2022 Best of the Best Community Choice Awards now through August 23rd. And on the topic of jobs or career opportunities here at Morton Hospital, we continue to recruit and grow our team. We still have a lot of great positions that are open, a lot of opportunities. We did have another hiring event on July 26th, and that was for all open positions. We did have a great turnout. We've extended several offers, but we have a bunch more positions open, whether it's nurses or CNAs, any of our clinical positions, to ancillary department positions, such as imaging techs or housekeeping. We have so many different opportunities available. And you can search our career opportunities anytime online through our website. You can go to mortonhospital.org and then click on career opportunities, or you can go right to jobs.steward.org. That's jobs.steward.org. And then you can narrow down your search based on the type of job you're looking for or based on location. We encourage you to click on Massachusetts and then select the town of Taunton, and then you'll see all of the positions here at Morton Hospital, as well as some open positions at our Steward Medical Group offices in Taunton and surrounding communities. So again, lots of great opportunities. We're always looking to grow our team and welcome great candidates. Right now, we're really looking for emergency department nurses and staff. So if you know any of your friends, family, neighbors who want a great career change This is a great place to work. We have a lot of great benefits, a great culture here, and we are accepting applications for all of our open positions. You can actually apply right online at jobs.steward.org. Once you find the job that you're looking for, you read through the description, the qualifications, and then at the bottom of that page, there is an apply online button, and you can submit your application right then and there. And lastly, just wanted to share with our community that we have welcomed a couple new providers to our medical staff here at Morton Hospital, as well as at Steward Medical Group. So Caitlin Martin, she is a family nurse practitioner. She has joined our SMG primary care at Northwoods practice. They're located in the Northwoods Medical Center building up on Bay Street. And because she is a family nurse practitioner, she does see patients of all ages. If you would like an appointment with Caitlin or any of the providers at that office, you can call 508-822-2266. Again, that's 508-822-2266. We have also recently welcomed Erin McDonough. She is a nurse practitioner and she has joined our pain clinic team. So the pain clinic is located right here at Morton Hospital, right up on our day surgery center unit, and she joins a great team. We're very fortunate to have her. They specialize in a variety of different chronic pain conditions, and if you're suffering from any of those, or you want to learn more about the pain clinic, you can give them a call, 508-828-7186. Again, that's 508-828-7186. And both Caitlin and Erin are accepting new patients, so give them a call if you need a primary care provider or if you want to pay a visit to our pain clinic here at the hospital. So that wraps up our show. We're just about out of time. We want to thank our listeners so much for listening today. Thank you to Amber for joining us. She was a great guest and shared some wonderful information with us about gastrointestinal disorders. And we will again post this show, if you're just tuning in, if you missed it, on our Facebook page later this weekend. So from all of us at Morton Hospital, we hope you have a happy and healthy week, and we look forward to joining you again next week, next Wednesday at 11 a.m. right here on WVBF, your hometown radio station. From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.